the pill was presented as a completely side effect free. It was all sunshine and roses. There were no downsides at all to taking these because your body already makes it. So what's the problem? But in the last, 50, 60 years, we've found that's not the case, correct?
Correct.
Okay, because I keep seeing articles where they mention it or they talk about the downside of hormonal birth control. What are the side effects that can come up that we're not interested in having, that are the negatives of this?
I know I mentioned earlier to Josiah that there is basically, it's called a USMEC, the United States Medical Eligibility Criteria for combined hormonal contraceptives. And so the best way to get a feel for some of these negative side effects is to look at those who it might be contraindicated for. And so we could start there. So in category 4, where there is unacceptable health risk in this case, one of the biggest themes that you'll see is anything that has anything to do with, issues with hemostatic parameters. That is what they call it. So any person who has a history of VTE or blood clots or cardiovascular disease, things that are in that realm, you're going to more often see in category 3 or 4.
Okay.
So the hormonal contraceptives, they're contraindicated in those with thrombogenic mutations, and there's a whole listing of those. Contraindicated in those with history of VTEs or DVTs, very high risk. Those with a history of coronary artery disease, diabetes with complications, complicated valvular disease, so like pulmonary hypertension or AFib. There are even more.
Okay.
There are even more, but that's one of the biggest issues. It doesn't happen to every single person, certainly, and you're more at risk if you meet some of those criteria, but it certainly can happen to anybody.
So it sounds like it can happen, and if it happens to the wrong person, that's a really, really bad thing.
For sure.
So for those reasons, anybody with those risk factors, they just say, don't even do it. Look elsewhere. So what other side effects? You were talking about the fourth class of people who just shouldn't do it because of blood clotting issues. Are there any others?
Yeah. The best way to look at these, I mean, we could list 100 million different things.
Sure.
Honestly.
Yeah.
We had a professor in school who broke out some of the adverse effects by looking at what we think is happening with the fluctuations in hormones. So, for example, what I'm saying is somebody who starts a birth control, we're looking at somebody who we now think has too much estrogen. Okay. Maybe it was too high of an estrogen product, or they're having side effects that lend itself to increased estrogen. Nausea, breast tenderness, increase in blood pressure, melasma, and headache. On the flip side, if we look at someone who we think there was maybe too little estrogen, we see early or mid-cycle breakthrough bleeding. And so that's often an issue, a potential drawback of a progestin-only product. Obviously, there's no estrogen component, so you might have to switch gears in that case. So again, early to mid-cycle breakthrough bleeding, increased spotting, hypomenorrhea, too much progestin component. We'll also see breast tenderness, headache, fatigue, and more changes in mood in this case.
All right.
The other aspect would be to look at somebody who is showing too much of an androgen response or having androgenic effects.
That's testosterone, right? Okay.
Increased appetite, weight gain, acne, oily skin, hirsutism, and even changes in blood lipids.
Got it.
So that's like the most broad way to look at the side effects. There are the potential for a lot of side effects.
Yeah.
Now, I think there's a statistic that 60% of those using hormonal birth control will discontinue their use within the first 3 cycles. And so that's maybe an access issue, a pain in the butt to get back to the pharmacy. Maybe they didn't get a 90-day supply, or maybe they had breast tenderness and nausea that was just intolerable for them.
Right.
You know, so the key is that there's no shortage of issue, but a lot of these can be managed before maybe pulling the plug altogether if this is still, you know, something that you know, based on your preferences and your background and in your shared sort of decision making with your doctor. If you still feel like it's something you want to pursue,
there could be other options.
There's a bunch of options.
Fair enough.
And
okay.
so again, it's like we mentioned at the outset, what you do from there is dictated on the specific product. What generation or what classification of progestin does it have? Is it this type of ethinyl estradiol? Could you start on a lower one? Could you maybe switch to a continuous cycle? Yeah. You know, there are many options. The other thing I want to mention is, you know, maybe some of the more lower issue side effects. It's recommended to wear sunscreen. These can cause photosensitivity, rashes, that sort of thing.
You should probably wear sunscreen anyway.
Try to avoid tanning beds. I know that's maybe challenging.
Yeah.
The other aspect, not to lose sight of VTEs and how serious that can be. There are some things that you can look for that might indicate if you're experiencing that phenomena.
Okay.
So, abdominal pain might potentially warrant further investigation.
Right.
There's a potential for even pancreatitis. There's a potential for gallbladder disease in some extreme cases. Chest pain, shortness of breath. That would be most indicative of pulmonary embolism, so a clot in the lungs. Severe headaches is something to be mindful of, especially if you're not something you've experienced before. Eye problems, blurred vision, flashing lights, blindness. I mean, very, very serious things. Severe leg pain, almost localized leg pain in the calf or in the quad or you know, somewhere in the lower extremities. Those are, you know, kind of more or less safety precautions.
That makes sense. I mean, if you cut off blood supply, it's going to have a lot of downsides. Wow. Okay. All right. Other than VTEs, what else we got? Is there? I know that I saw one report talking about breast cancer. I know I've seen a couple of things recently talking about depression. Mm-hmm. What's going on with that? Yeah.
So there's actually in terms of cancer, as always, you have to look at the specific cancer that we're referring to. Breast cancer is one example where if you currently have breast cancer, it's an absolute contraindication for you to go on hormonal birth control.
Because that's is it HER2 positive breast cancer that you take an agent to block estrogen production? That would definitely play a role.
Okay. Yes.
So this is why you would. Okay. Got it.
Ultimately, yes. And just to mention, there's less of a risk for if you're on birth control for an extended period of time, there's actually a lowered risk for endometrial cancers and ovarian cancer.
Oh.
So just to kind of spin that the other way. But yes, breast cancer is something to absolutely be mindful of, history of breast cancer. Now, there is some nuance to that as well. I would say that, you know, if you have a family history of breast cancer, I don't believe that it necessarily makes you absolutely not a candidate. But all of these sorts of things are addressed when deciding if this is an option.
Okay, so there is an increase in breast cancer risk. Are we talking like a 10-fold increase, or are we talking about, you know, a marginal increase?
The whole way to square this cancer circle, so to speak, the combined options, they actually have a protective effect against endometrial and ovarian cancer, but they are associated with the increased risk of breast cancer diagnosis in current or recent users within the past 6 months, for example. The incidence is 68 cases per 100,000 person years, compared with 55 cases per 100,000 non-user years.
Okay, so
68 versus 55.
So it's an increased risk, but it's not an enormously increased risk. And upon cessation, upon stopping using it within about 6 months, your risk goes back to what it was before?
Right.
Okay.
And additionally, there are no associations of past contraceptive use with increased rates of cancer, and there is no association of past contraceptive use and mortality.
That's a good thing.
Although there are risks and there are many complications that can arise if you're potentially not an appropriate candidate for what was selected.
Sure.
It's still something for the vast majority that can be safe and effective.
Sure. All right. So when it comes to depression, we don't know a whole lot about that, but what is your take on that? Without digging into deep studies and stuff here, what have you got?
I think it's logical to say that there would be the potential for mood changes in supplementing with exogenous hormones.
Makes sense.
So I think at the most fundamental level, it makes complete sense as to why that can occur and does occur in women of all ages. But I think that a lot of that can be mitigated with selection. So there are certain options, or just you say the heck with it. We tried it and something happened to my mood and it's not worth it. I think that's a very viable reason to explore something else.
There are other options.
There are other options.
That makes sense.
There are, but there are also other options within the combined and progestin alone.
Is that
options.
the mini pill versus the pill?
Mm-hmm.
Okay. All right.
Mm-hmm.